We are the Gujarat Technological University. Since its inception over a decade ago, GTU has been empowering young and curating minds to realize their true potential. Over 4 lakh inspired students are enrolled with one of the premier academic universities in India.
Hello everyone, this is Dr. SUBHASH and today we will discuss about the introduction portion of the suspension in the chapter course dispersion in the subject Physical Pharmaceutics 2. So, first, what is suspension? Suspension, it is a coarse dispersion in which insoluble solids they are suspended in a liquid medium. Here we are mixing the insoluble solid with the liquid, and as a liquid medium we are using water or water based vehicle. Here the particle size range of the solid that is in between 10 to 1000 micrometer, and the suspension they are also called as heterogeneous system or the biphasic system. Here in case of suspension we are using two phase, that means one of that is the water and another one phase that is the solid material, solid ingredients. So that's why we can say it is a biphasic system, or also we can say it is a heterogeneous system, because here the two phases they are not visible to each other. That's why it is known as a heterogeneous system. We can say the solution they are homogeneous system in which two phases they are visible to each other. That's why that solution that is a homogeneous system. But the suspension over here we are using two phases, one of that is the solid and another one that is the liquid. So that's why it is known as a heterogeneous system or the biphasic system. So we will discuss over here about the advantage of suspension. Suspension, it offers various advantage. For example, first one that is the stability. Here most of the drugs they are not stable in a solution. So in such a condition it is highly required to prepare insoluble form of that drug so that it cannot degrade. Especially decreases here by converting any drug to the suspension, it decreases the degradation of drug, and by which it improves the stability of the product. One of the example is there. For example, if we have the procaine-penicillin G, it is more stable compared to the penicillin G. Procaine-penicillin G that is available in a suspension form, so that's why the stability point of view that is more stable as compared to penicillin G. Second one, that is the choice of the solvent. If the drug is not soluble in water, so many active pharmaceutical ingredients are there which are not soluble in water. So in such a condition, solvent other than the water they are not acceptable, and in such a condition it is highly required to convert them in a suspension. For example, corticosteroid that are injected as a suspension only. In case of corticosteroids we need to prepare the suspension in a water only, so that's why we are having the product of corticosteroid injection in a suspension. So in special case where there is not possible to use any other solvent, in that condition that is highly required to convert them in a suspension. So in such a condition suspension that is advantageous. Then mask the taste. So many drugs it having the unpleasant taste, and here if we are converting them into the suspension, then we can mask the taste by addition of the flavor or the sweeteners. We can use these both the things, and by that we can mask the taste. Especially in case of pediatric patient, where the taste that is very much important. If we are giving product to the children, so in that condition, if the bitter taste is there, then it will not be acceptable by the patient, or we can say by the children. So in such a condition, always the masking of the taste that is required, and if we are converting the product in a suspension, then it is possible. For example, chloramphenicol, that is chloramphenicol palmitate, that is preferred over the chloramphenicol, which has a bitter taste. Chloramphenicol, it has bitter taste. So if we are converting them into the chloramphenicol palmitate and converting into the suspension, then the taste will be masked. Same way, one another example is there. Quinine tennant is preferred instead of other quinine salt. So here, in case of quinine tennant, it is also possible to mask the taste. So one of the advantage with the suspension, that is, we can mask the taste by converting the product into the suspension. Then prolonged action dosage forms. For example, some of the drug that can act as a reservoir, which can give the sustained release of the drug. So here one of the example is there. For example, protamine zinc insulin and propanpenicillin G, they can act as a reservoir. We can also say Nepot formulation, which releases the drug slowly, and slowly it will go to the circulation. So by this way, the drug will give the prolonged action. So this is also advantage of the suspension. Then bioavailability. Bioavailability, that means availability of drug in a blood. Now, in the case of suspension, if you are converting the product in a suspension, then as compared to the tablet or capsule, it gives higher bioavailability, as the particle size will be decreased in case of suspension, and due to that the surface area will be higher. So due to that, we can say the bioavailability of suspension that will be raised. Here one of the example is there. For example, antacid suspension, it provides immediate relief compared to the antacid tablets. And if you are converting the suspension, antacid suspension, then it will give higher bioavailability as compared to the tablet or capsule. So these are regarding the advantage of the suspension. Then disadvantage. Biggest disadvantage we can say with the suspension, that is the sedimentation of the product. In the formulation, the sediment of the solids, occasionally it gives the false alarm about the suitability of the product. So sedimentation, that is one of the disadvantage. Then another one we can say, that is the dose precision, that cannot be achieved over here unless the suspension they are packed in a particular unit dosage forms. Therefore, the potent drug cannot be administered in this form. Here the potent drugs cannot be administered if there is no dose precision, because potent drug, that means in very small amount it gives highest effect. So in such a condition, potent drugs, the dose of the potent drugs, that is very low, and in that condition, if the dose precision is not there in case of suspension, then the potent drugs give the negative effect, or it might give the side effect. There might be the changes in the dose when we are taking. So due to that, if potent drugs we are converting them into the suspension, then it shows the problem. So potent drugs should not be administered in a suspension. Then physical stability. Sedimentation and compaction of sediment, it causes the problem, and that by no means an easy task to solve. So sometimes the stability, physical stability, that is also important. So this is also one of the disadvantage of the suspension. Then product, they are sometimes liable to oxidation and hydrolysis. Here the chemical stability, that is also very much important. So sometimes oxidation or the hydrolysis of our product, that is possible, especially because we are using over here the water. Then another one disadvantage regarding this, that is the preservation of the product against the microbial attack. See, we are using again water as a medium, then due to that there might be the higher chances of the growth of the microbes in the water. So always we need to have added preservatives in our product. So one of the disadvantage we can say, that is the preservation that is required. Then next one, that is the handling and transport. As the suspension, that is very bulky, and due to that the sufficient care it must be taken, and always we need to transfer it from one place to another place. So always it is filled in a bottle. So meanwhile the handling and meanwhile the transportation from one place to another place, care should be taken, because otherwise there might be the chances of the breakage of the bottle, and also due to the bulkiness of the product it might create the problem. So these are the disadvantage of the suspension. Then ideal characteristic of suspension. What and how should the suspension should be prepared, and so that it gives the maximum effect. First one, we can say what are the characteristic of an ideal suspension. That suspension, in suspension, solid should not settle rapidly. In whatever the product we are preparing, for example, we are preparing the suspension, the solid particles should be of such a size that they do not settle rapidly. Rapidly settlement should not be in our product. Then it should not form a hard cake at the bottom of the container. See, in some type of suspension, it will form the hard cake. Once we are doing, the hard cake will be formed, then it will not be resuspended. So it should not form any type of hard cake at the bottom of the container. Then, if in certain condition the hard cake or the sedimentation that occurs in our product, then it should be easily redispersed. So this should be the ideal characteristic of the suspension. Then viscosity. We should have the ideal viscosity so that it should be easily poured from the bottle. See, if we will have the higher viscosity, then it will not remove from the bottle. And if we have less viscosity, then also it creates the problem. So the ideal viscosity we should have, through which the product it should be easily poured from the bottle. Generally, we are taking the suspension into the spoon. So at that time, it should be easily come out from the container. So this is also one of the ideal characteristic of the suspension. Then salt should easily injected through the needle of a syringe. So particle size, here we need to consider the particle size and also the viscosity of the suspension. It should be like that, so it can be easily injected through the needle of a syringe. Sometimes if the particle size that is higher, or in that condition, it will not come out through the syringe. So particle size, it should be precise or it should be maintained, and accordingly the viscosity it should also be maintained. Then it should be easy spreading and it should leave a film of medicament. If we are using any topical product or if we are preparing the topical suspension, then it should leave one of the mark and it should be easily spreaded on the skin. If we are applying for the skin, then if we are using it for a skin, then the spreading of our product it should be very easy, and it should leave a film of medicament so that easily we can come to know that we have given product over the particular area. So once it forms one of the film, then we can easily come to know about where we have applied the product. Then next one, that is the acceptable taste. Suspension, if we are using for oral product, then it should have the acceptable taste so that patient acceptability it will be raised. And if you are using it for a pediatric dose, then always it should be good in a taste and good in a flavor. Then it should resist the microbial attack. So always we should add the preservative if it is required. We need to add preservative in our product, but anyhow the microbial attack should be resisted. So these are the ideal characteristics of the suspension. Then classification of suspension based on proportion of solid. Based on proportion of solid, we can convert them into two different portions. One of that is the dilute suspension, and another one that is the concentrated suspension. Dilute suspension, that is, it contains 2 to 10% weight by volume of the solid, whereas concentrated suspension, it contains 50% weight by volume of the solids. Then depending on the nature and behavior of solid, again they are converted into two types: deflocculated suspension and flocculated suspension. Deflocculated system, here the solid they will act as an individual particle. They also exhibit the aggregates, but comparatively at a slow rate than that of the flocculated particle. They have the shorter shelf life but have a greater bioavailability, as the particle they are acting as a separate entity. That's why in case of deflocculated suspension, the bioavailability that will be higher. Then another one, that is the flocculated suspension. Here the particle they will form the aggregates, and by the aggregation will be formed by the chemical bridging in between the particle. They are known as a flocks. So in a case of flocculated suspension, there will be the presence of the flocks, which are light and fluffy. So due to that, the particle they will sediment very fastly over here in case of flocculated suspension, and here the particles they are attached with the van der Waals forces in between them. Here also the aggregation will be achieved, and for aggregation we can use the flocculating agent. So these are the, depending on the nature and behavior of the solid, we can say there are the two types, deflocculated suspension and flocculated suspension. So over here in this video we have considered introduction of suspension, where the definition we have considered, then the advantage of suspension, disadvantages, the characteristic of an ideal suspension, and we have studied about the classification of suspension. So this was about the introduction of suspension. Thank you for watching this video.